Hello, my name is Dr. Seemal Desai. I'm a board-certified dermatologist specializing in diseases of the skin, hair, and nails with a particular emphasis on pigmentary disorders. I'm the founder and medical director of Innovative Dermatology and clinical associate professor of dermatology at the University of Texas Southwestern Medical Center in Dallas, Texas. In my clinical practice, I often treat patients with vitiligo, which is an autoimmune dermatological condition. In patients with vitiligo, the body's immune system attacks its own pigment-producing cells called melanocytes, resulting in depigmented patches of the skin, hair, and mucosa. Based on a recent population-based survey, the prevalence among adults in the US is estimated to be 0.76% for clinician-adjudicated vitiligo and 1.38% for self-reported vitiligo. A crucial first step in improving the lives of our patients is strengthening our understanding of the different clinical presentations of vitiligo to help guide prognosis and tailor appropriate management. With that in mind, during this video, I will briefly talk about the different clinical classifications of vitiligo. To start, vitiligo is clinically classified into two main types: non-segmental vitiligo, which affects both sides of the body, and segmental vitiligo, which most commonly only affects one side. Non-segmental vitiligo, often referred to as generalized vitiligo, is the more common form of the disease, accounting for 90% of vitiligo cases approximately. Non-segmental vitiligo is characterized by loss of pigmentation, resulting in discolored patches of skin and hair and mucosal cells on both sides of the body with lesions that are often symmetrical. Although it can manifest at any age, it is most common in patients between ages 10 and 30 years. Non-segmental vitiligo is characterized by its progressive nature and widespread distribution throughout the body. Some studies have also suggested that non-segmental vitiligo is more commonly associated with other autoimmune conditions, such as Hashimoto's thyroiditis, Graves' disease, and alopecia areata, which is different from the other form of disease, segmental vitiligo, which I will discuss shortly. There are several different subtypes of non-segmental vitiligo. Generalized vitiligo is characterized by bilateral and often symmetrical patches that are randomly distributed throughout the body. Mucosal vitiligo tends to involve oral and/or genital mucosa. Acrofacial vitiligo, as the name would suggest, is limited to the face and/or distal extremities. And vitiligo universalis is a term that refers to complete or near complete depigmentation of the skin and hair over the entire body. On the other hand, segmental vitiligo, which is the less common form, usually accounts for only about 5 to 16% of cases. Segmental vitiligo most commonly appears unilaterally, which is only on one side of the body rather than on both sides, like in the case of non-segmental disease. Depigmented patches in segmental vitiligo are distributed over a limited part of the body, such as the face, arm, or leg. Unlike non-segmental vitiligo, which is progressive in nature as we discussed, segmental vitiligo is characterized oftentimes by a sudden onset of the disease, followed by rapid stabilization, typically over 6 to 24 months. Onset occurs at a younger age than in cases of non-segmental vitiligo, with approximately 41% of patients diagnosed before the age of 10. The most common affected area in segmental vitiligo is the head, followed by the trunk, limbs, extremities, and neck. There are multiple subtypes of segmental vitiligo. The most common is unisegmental disease, in which there is only one segment of depigmentation. But less common subtypes include bisegmental and multisegmental vitiligo, in which there are 2 or more patches respectively. In rare cases, patients can also develop mixed vitiligo, in which segmental vitiligo develops on one side of the body, but other spots characteristic of non-segmental vitiligo also develop in other parts. Focal vitiligo is an additional type of the disease characterized by small, isolated, depigmented segments without a distinct distribution pattern that have not changed after 1 to 2 years and can eventually evolve into non-segmental vitiligo or even segmental disease. In summary, non-segmental vitiligo is more common, appears bilaterally, and is progressive in nature, while segmental vitiligo is less common, appears unilaterally over a limited part of the body, has a sudden onset, and stabilizes rapidly. Segmental vitiligo also has a younger age of onset than non-segmental vitiligo. In conclusion, understanding whether patients have non-segmental or segmental vitiligo is critical as it helps us guide prognosis and informs management decisions. And therefore, raising awareness about these clinical classifications remains important to ensure that patients receive the right care at the right time. For insights on how vitiligo is classified as either stable versus active disease, please check out our other video in this series.